Spanish authorities are preparing for the expected arrival tomorrow of the cruise ship, where a deadly outbreak of hantavirus was discovered. So far, at least 8 cases of the virus have been confirmed, and 3 of those infected have died. 17 Americans are still on board that ship. At least 6 other Americans who traveled on that ship have returned, and health officials in 6 states are closely monitoring those people and anyone that could have been exposed. But there are 0 reported cases in the states, and the World Health Organization says the risk to the wider public is low and that this is not like COVID. What may be more concerning is the U.S.'s response to the outbreak. The New York Times notes that it took nearly a month after the first patient's death for the CDC to set up a team to respond to the outbreak. They say, quote, the administration's sluggish response and lack of communication suggests the United States is ill prepared for a larger health crisis. And because of deep staffing cuts the Trump administration has made to the CDC and other health agencies, the government has far fewer people to respond to outbreaks. And while the WHO has been coordinating efforts, the Times points out because President Trump withdrew the country from the World Health Organization, the United States does not receive regular information from member states about emerging health threats. Joining us now is Dr. Daniel Jernigan, former CDC director of the National Center for Emerging and Zoonotic Infectious Diseases. He resigned in protest from the CDC last year following the firing of then CDC director Susan Menarez. Dr. Jernigan, thank you so much. So first, can you explain to us what the hantavirus is and what this rare strain is? Give us a reality check, please.
Yeah, sure. And so this is a virus that normally hangs out with rodents. It's very common in rodent populations, but people, when they come in contact with those rats or those other kinds of rodents, they can get infected through the feces, through the urine, through things that get kicked up in the air. Once you get that into your body, these viruses in the South American and North America cause a thing called hantavirus cardiopulmonary syndrome. And that just means that it infects the lungs, infects the heart, and such that your vessels open up and you start to leak fluid and you can't breathe. So this is a bad disease. You can have a case fatality ratio of about 30 to 40%. But even though it is bad and lethal, it's not that easy to get. It is actually pretty hard for it to get from one person to another. And I think it's important to recognize that right now, this is not a pandemic that is starting. This isn't another COVID, and the risk to the American public is extremely low.
Thank you for that reality check. I think it's calming some people's nerves. I am people for a lot of reasons. But when you look at what we've seen at the CDC, you left because of what was going on with Dr. Menarez. A lot of people have. The RFK Jr., who's the head of HHS, CDC's under there, he fired all the cruise ship inspectors. A hantavirus outbreak starts on this one ship then. With all that the American people have seen when it comes to the HHS and the CDC and this administration and how it gaslights them on everything, who should they be looking to for information as they watch this situation unfold?
So there's a couple of things there, and that has to do with confidence. And so who do I have confidence in? I have confidence in those staff that are involved in this outbreak right now. There are excellent scientists, people who have been working in this space for years, sometimes 30 years. They're the world's experts. Where I'm having some issues with confidence is with the political leadership right now. They're, I believe, making decisions that are not necessarily in the best interest of getting the word out about what's happening. It would be great if we could have more information. So the things to happen, I think, would be to let those good scientists at CDC who are doing incredible work, let them speak, let them do their job, essentially get out of the way and tell the American public what's going on, because they have information that would be very useful to hear from a scientist so that people would not be so concerned about it. Right now, you're hearing most of it from WHO, you're hearing it from the news media. Let's hear it from the experts at CDC.
Dr. Jernigan, I do want to get to fact-checking some of the misinformation that's been swirling around about treatments for hantavirus. But I have to ask you, because I texted my family yesterday that I was putting a moratorium on family vacations on cruises. Do you have any feelings about cruises as a vector for these kinds of infectious illnesses and best practices that crews, staff, and directors and doctors should be taking? Because some of the footage is now trickling out, cell phone video that passengers have taken as the cruise director is announcing a death on it. And I don't know, it doesn't make me want to take a cruise.
Yeah, the cruise ships, we know, because you put a lot of people together, are likely for transmission to occur. The cruise ships, compared to other kinds of vessels and other situations like hotels and so forth, they're actually fairly well regulated. There's a vessel sanitation program at CDC that makes sure that those vessels are maintaining the right amount of safety. And because of known issues with norovirus and other kinds of viruses that can spread easily on ships, there's a lot of rules about what you do to try and prevent that. This particular ship was one that was picking up people that had unusual exposures, and a very rare event where that thing was able to get onto the ship and cause illness with other people. Right now, I think if you're getting on ships, you're going to need to follow the appropriate kinds of infection control and good hygiene that you would normally do on a trip. But at this point, I don't know that what we're seeing with this particular boat has a necessary implication for those usual cruises that people take.
And can we ask you about this Marjorie Taylor Greene tweet that she's been pushing false information, what I believe is false, that ivermectin is a treatment for hantavirus. She posted on X that she had texted with her doctor and that the doctor advised that hantavirus could be treated with ivermectin, vitamin D, and zinc. Those of us who refused to lock down, mask up, and get vaxxed took the good old horse paste and also developed natural immunity. She's obviously referencing pushing ivermectin as an alternative treatment and a cure for COVID-19. Can you give us your doctor's assessment of this treatment?
For hantavirus infections, there is not any drugs that really work. They've done studies to try and find some that would. There are no vaccines that work. They're trying to find vaccines that do that. The best thing you can do for hantavirus is supportive care. That is, make sure you get to a hospital, get on a ventilator, get fluids and things like that. It is interesting the life that ivermectin has. It shows up as a treatment for a number of different things. It's a drug that is very effective for river blindness and for parasitic infections. It is not a drug that you use for hantavirus. And so I don't know that it has much impact because I don't believe that the hantavirus is going to be showing up anywhere in your neighborhood. However, hantavirus is not a treatment. The ivermectin is not a treatment for hantavirus.
Doctor, very quickly before we go, in addition to all of this, the FDA has blocked publication for several studies supporting the efficacy and the safety of taking vaccines, COVID and shingles. So you say that it's important for the public to listen to the scientists, but I don't think the administration is going to let the scientists get out there and talk. So can these agencies be trusted?
So that is an issue that a number of us that left had, and it wasn't necessarily the people, it was the processes. They were not following the science, not letting the evidence be what was directing them toward the recommendations. With this particular study that was not pushed forward at FDA, with another study that Dr. Bhattacharya did not let come out of CDC on COVID vaccine effectiveness, these are both indications of how the administration is trying to stop the science from coming out. That is not gold standard science that they purport to want to support. It is not radical transparency. So the best thing that can happen is to let the science speak for itself, let the scientists speak, and let that science help drive us toward best evidence-based recommendations.
Hope springs eternal. Dr. Daniel Jernigan, thank you so much for joining us this morning.